This is Roshan Shetty. I head the life sciences and healthcare business for Infosys across Europe, Middle East, and Africa.
Hi, Roshan. It's a pleasure to be here. Yes, Frank Gulitz. I'm the CIO of Mobile Health AG here in Zurich, and we are producing a platform who are helping cancer patients to manage their therapy and their therapy outcomes.
Wonderful, Frank. Happy to actually have you in this conversation. I think we have been hit by some unprecedented kind of pandemic situation that COVID-19 has thrown across. And it has actually changed the entire paradigm of actually healthcare industry. What is your perspective on this?
Yeah, I mean, it's an outstanding situation, and I think healthcare has needed to react it very fast. Many good applications came up to COVID. I think the major issue which we're having facing is that all this good work will be facing down because the cultural change in the clinic treatment as well as out clinic treatment will still take some time. But very impressive was also that government was reacting very fast to use new medias and new applications to track the COVID-19. Unfortunately, as you see in many publications, the standardization of the data which we're gathering right now to COVID-19 is very limited. So we will have a lot of data where data scientists have to do a lot of work to get this been done and use it for the future.
Frank, if we now pivot towards technology, we have always actually seen technology being a key player in the healthcare industry. We have seen it more in the spaces like the triaging of actually the cases at the initial and to give some inputs to the physicians or the clinicians. So, how do you see the confluence of technology along with the regulatory kind of requirements that are actually there, right, through all the regulators?
Technology over Internet of Things as well as wearable devices will change tremendously the whole area about managing your health as well as managing your diagnosis and managing your sicknesses. I think the biggest problem which we have right now, and honestly, we are looking for many partners right now around this, is that you have to have the breadth to have a digital device certified. And I think that area about the digital certification, CE certification, MDD, MDR certification, is quite a tremendous burden for something which is not an invasive instrument. The whole ecosystem will only work when you have high quality standardized data. So when we're looking right now into predictions around health through wealth and wellness, through historical medical records, as well as life behaviors, as well as treatments, the problem is to put this all together to get the right output for the physicians as well as for the patients or any other caregivers like social caregivers, elderly caregivers behind it. It is tremendously important that we are starting to find really the right standard to exchange the data between each other for the better good of the patients. I think the regulator needs to come a little bit down with the areas which we are gathering data, and we're gathering data in a high standardized area, which are not invasive gathering of data, should be made more easy. The whole exchange of data, which we have here with the electronic patient dossier in the Swiss, where you can decide as a patient who you give your data to for which kind of purpose, is, I think, a very strong thing which we need to do. And only then technology can make an impact, because it is all about the data. It's like you have said before, medical devices always been enhanced. Bias has been enhanced to get the accuracy of the diagnosis been better, to get the cost for the diagnosis being better, all for the goodness for the patient. This discussion, we know it will take a while, but I'm really looking for an ecosystem of disruptive thinkers in the health system which will cooperate with each other.
We're happy to kind of, from an Infosys perspective, be a partner in this journey and actually make sure that the patient and the patient care systems actually work very closely to deliver the best care system across the globe. Thank you so much for your time.
Thank you very much, Roshan, and thank you for all your support with all your teams behind it. It's a pleasure to work with you guys, and looking very much forward to disrupt a little bit the health ecosystem together.